Hi, and welcome to SimLab this semester. My name's Larissa Miller, and I'm just going to take a couple of minutes and give you a little bit of what to expect this semester as you come to simulation. SimLab is located in HHS 316. It's upstairs on the third floor, kind of in the northeast corner of the building. And when you arrive, you'll just be waiting outside that door, and our faculty will come and get you right at the beginning of your lab session. Each of you is scheduled for one 4-hour block in SimLab this semester, and we will use that whole 4-hour time to put you through several different simulations and then to talk about what you're doing. A couple things to expect when you come to SimLab, and we want to make sure that you feel well prepared for your day. The first thing will be to arrive in your uniform. Since we are using part of your clinical time for simulation, you'll be wearing what you would wear to clinicals, your full uniform, shoes, and bring anything you would need for that clinical day, stethoscope, pen, anything that you would normally have with you. A couple other things you'll need to bring to SimLab when you arrive. The first one is your SimLab student manual, and it looks kind of like this. This is found either on your Course Angel site that you'll be downloading and printing, or it's already included in the supplemental that you bought for your course. Either way, you do need to bring your whole lab manual to SimLab. We'll be ripping out pages for you to use. We'll be looking at some of the forms that are in there, and you do need to come with the whole pack. I'd like you to look through that pack before you get to your lab time. You don't need to memorize it, but just flip through it so you're kind of familiar with what to expect that day. We've outlined the types of activities that we do and some hints for you in that lab manual. Another thing that you're going to need to bring to SimLab is your MLS kit, which looks something like this. This can be purchased downstairs in HHS at the medical locked storage window, which is on the garden level of HHS. You are only needing to purchase one kit for each lab session. So however many students are in your SimLab day, usually between 4 and 6, you're going to be able to split that cost between all 6 of you for the one lab kit. You do need to pay for that lab kit with a star card at the MLS window. Please bring that to your SimLab day. That's how we replace what we've already set up for you to use. Some other things to remember when you come to SimLab. SimLab is considered part of your clinical time, but it's not currently graded. The way that we grade in SimLab is very easy. It's pass-fail. If you come and you give us good effort and show us professionalism and some good work that day, you're going to pass. There are some ways that you cannot pass SimLab. One would be to not bring your MLS kit. Another would be to not show up in uniform. And the third would be to not put forth that good effort and good professionalism. The way that we would mark any delinquencies in SimLab would be on your clinical evaluation tool, and that might result in a 1, which could lead to probation. So follow the general guidelines in your SimLab packet and you're going to be just fine. A couple other things to remember when you come to SimLab. Again, remember that's in HHS 316. You're going to be scheduled for that whole 4-hour block, but we do give you breaks and a chance to stretch your legs, take a breather, feed the meter, or have something to eat and drink if you like. With that in mind, we're asking that you don't bring any food or drink into the SimLab. If it's stashed in your backpack, it's totally fine, but we won't be able to let you eat or drink around all of our computer, camera, and audio equipment. When you come to SimLab, you will be videotaped and you will be audio taped as well. And that is only for use that day with your lab group. We don't show it to other students or even to other faculty. It's just for our use that day. It's probably for a lot of people the worst part about SimLab is that you're being videotaped. But please rest assured that you'll get used to it. None of us like to see ourselves on camera, but it's actually a pretty cool thing to see yourself in action. When you come to SimLab that day, you're going to be put through a couple of different scenarios. And if you're returning to SimLab, they're going to be all new to you. And the way that we do simulation is that we structure some clinical experiences you might not be familiar with yet, but may definitely be something that you're learning in your class. We put you through the activity by having you work with our mannequin in a patient room. And the mannequin talks to you, blinks, has blood pressures, pulses, and definite assessment findings like lung sounds, heart tones, and so on. We then gear the scenario to have you work as a real nurse in real time. It's kind of a on your own experience, but we're there to help you as well. Above all, I don't want you to be nervous about coming to SimLab. I want you to know that I feel it's an amazing learning tool. I think you'll get a lot out of it. It is a big period of time, but I think you'll find that the time really flies and you might even enjoy yourself along the way. So, just to remember, if you can make it to SimLab up in HHS 316, don't forget to bring your whole lab manual, your whole MLS kit. Come dressed in your uniform. Come with good attitude, good effort, and we're going to really be looking forward to seeing you. Thank you.